Hello buddies, today, in this video we will talk about thalassemia. Thalassemia. Normally, equal quantities of alpha and beta globin chains are produced during the synthesis of normal adult hemoglobin. Thalassemia syndrome develops when one of these chains is reduced or absent and results in excessive production of the other chain. Definition. The thalassemia syndrome is a heterogeneous group of inherited disorders that result from a genetic abnormality of globin production. There is decreased or absence of synthesis of either alpha or beta globin chain of adult hemoglobin, HbA, that is alpha-2, beta-2. Alpha globin genes are present on chromosome 16 and beta globin on chromosome 11. Classification of thalassemia. Thalassemia syndromes are mainly classified into two types depending on the defective globin chain. Beta-thalassemia syndromes, these are characterized by the impaired synthesis of beta chains of globin. Beta-thalassemia syndrome is the commonest and most prevalent worldwide, including India. Alpha-thalassemia syndromes, these syndromes are characterized by reduced synthesis of alpha chains of globin. These are seen mainly in Southeast Asian countries and India. Beta-thalassemia is a hereditary disorder characterized by diminished synthesis of structurally normal beta globin chains, associated with the unimpaired synthesis of alpha chains. Molecular pathology of beta-thalassemia. Beta-globin genes are located on chromosome 11. At the molecular level, many different types of mutations in the beta-globin gene have been identified in beta-thalassemia. These mutations may result in partial or complete deletion of a gene or affect a single nucleotide base. Depending on whether beta-globin chains are produced or not, the causative mutations are mainly categorized into two. Beta-degree mutations, characterized by the total absence of beta-globin synthesis. Beta mutations, characterized by markedly reduced or diminished, but detectable, beta-globin synthesis. Here there is a clinical and genetic classification of beta-thalassemia. They are broadly classified into three types depending on the severity of the anemia, which in turn, depends on the genetic defect, beta or beta degree. Table, clinical and genetic classification of beta-thalassemias. Signs and symptoms of thalassemia. Fatigue, weakness, pale or yellowish skin, facial bone deformities, slow growth, abdominal swelling, dark urine. Chemical findings. Bilirubin, increased, mainly of unconjugated type. Urine urobilinogen, increased. Serum haptoglobin, markedly reduced. Serum iron status. Serum iron, serum ferritin, and transferrin saturation are markedly increased. Total iron binding capacity, TIBC, reduced. Special tests used to detect thalassemia are followed as fetal hemoglobin, increased to 30 to 90%. Hemoglobin electrophoresis. Beta-thalassemia, demonstrates bands of both HbA and HbF. Beta-degree thalassemia, since no beta chains are formed, there is no HbA. Major hemoglobin is HbF with normal or low HbA2. Performance chromatography, HbF is increased, 30 to 90%. HPLC measures various fractions of hemoglobin and is used for confirmation of diagnosis. Prenatal diagnosis by molecular analysis of DNA. Estimation of globin chains, normally, beta ratio is 1:1. Lack of beta chain alters this ratio to 5 to 30:1.